There's some technical challenges on this end. Calling to order the Boulder County Board of Health regular meeting for December 11th, 2023. It is 5:36. We have item 1 on the agenda, or I guess we'll do a quick roll call of who's present for the record. Morgan McMillan, president. Amber Johnson, board member.
Brooke Harrison, board member.
If you're online.
Brooke Harrison, board member.
All right. Hello, Mike. Lindy, can you speak now?
Jordan, I'm so sorry. This is Lindy. Can you hear me?
Yes, we can hear you.
Okay. Sorry, I could not get through. I am here. Board member Lindy Hinman.
You to board. Item number 1 is public comments. And before we begin, just read a brief statement. The Board of Health provides the opportunity for the public to share their viewpoints and opinion on public health matters. It is not the practice of the Board of Health or agency staff, many of whom are top experts in the field, to review, vet for accuracy or grounding in scientific evidence or provide responses to public comments at Board of Health meetings. Opinions expressed by the public should not necessarily be interpreted as accurate if staff or the board does not challenge that perspective. Okay, nice. Thank you.
All right, and we had one member of the public signed up to give spoken testimony. So Ryan, I'm going to make you presenter, and your 3 minutes will start whenever you're ready.
Sounds great. Thanks for the opportunity to speak again. Unfortunately, I can't be there in person, but we'll make an effort in one of these upcoming meetings. Certainly applaud the 18% funding cut that you received. I think your leadership was abysmal. I don't think I need to reiterate that too much, but you led with a lack of transparency and you tried to lead with a strong fist that did not serve the community well. So you didn't lead with trustful guidance. And I think if you're top experts in the field, as you claim, then you wouldn't cower from what the data is saying now. Truthfully, it seems the vaccines that you were trying to tout as safe and effective and 100% effective against transmission at one point in time are far more dangerous than you, the scientific community, admits. I think you're exchanging leadership certainly doesn't serve yourself well. And I think, frankly, you should have a roundtable with the community because you just insulate yourselves. And me speaking to you in 3 minutes remotely doesn't do much. You ought to open it up and have more of a conversation. That would be helpful. These COVID vaccines you kept pushing forever. They stopped working against infection within a few months. Now they have negative efficacy if you have to actually dive into the data. You cast anyone that spoke out against them, like myself, as being ignorant, stupid. You published your own guidelines that said that clearly. But people aren't fools. They know the mRNAs didn't perform as advertised. That brings me a little bit of solace after 2 or 3 years now. Demand has entirely collapsed. No one's taking boosters, despite aggressive marketing from you, the public health officials, operating as pharma's extension. And, shares of those companies respectively have plunged as well. I would strongly encourage you, look around for different views. Go look for Edward Dowd, D-O-W-D. He runs a global macro investment firm. He's very focused on high-level data sets and analyzing data that's clearly out in front of everyone and making investment decisions on that. He's a great source of information. Same with Steve Kirsch, who's openly put up a number of poignant points on the vaccine and kind of what's happened since. You guys have fallen radio silent after blasting that in our faces every day for 2 years. So the COVID vaccine after that 4th booster has shown that the number of deaths should monotonically decline over time. That's untrue after 365 days with the COVID vaccine. So you guys know you're not being truthful with the community. You clearly have stopped talking about it, which is fine. That's great. I'm just waiting for what's the next thing down the road. A positive slope for 1 year post-vaccination is completely unprecedented. It means the vaccine's killing people. You still refuse to acknowledge that there's one adverse event from that. And I think that's terrible.
That concludes public comment.
Okay, thank you, Ryan. Item 2 is approval of the November 11, 2023 regular meeting minutes.
This is Brooke. I move that we approve the minutes.
Full second. Okay, we have a motion and a second. All in favor? Aye. Great. Okay, motion passes. Gonna be approved. Thank you. Item number 3 is the OWTSP approval.
Good evening.
Yeah.
Lexi Nolan, Executive Director, Boulder County Public Health. This proposal is to reset our OWTS fees, commonly known as septic permits. This is a required function of county health departments. And in conversations with our commissioners over the past year, they expressed a strong desire for us to internalize as many of our fee-based programs as we could. This is really the only fee-based program that produces significant revenues that we have control over. And so we have taken a close look at that this year. The process has been a little bit lengthy because we wanted to get it right. We have created a structure to prorate the fees largely according to the time needed to process each permit. And that's a new development. We have added several more permit categories to better capture differences in that time needed and some subtleties of the differences in different kinds of permits. We have reviewed the new amounts with CCPH leadership. We had presented this to the Board of Health a few months ago. You all had some suggestions for us and some questions for us to double check on, which we have done. The team has adjusted the revenues according to those Board of Health statements in terms of where burdens are. And we have also requested feedback from our community partners in this space on the proposed fees. And I am happy to turn it over to Aaron Dodge, who is our water quality lead and leads this team to give you some additional details.
Thank you, Lexi. Good evening, board. Aaron Dodge, Environmental Health Water Quality Program Coordinator. And as Lexi did a great introduction, I think we can jump right to the next slide. So the major, some of the additional fees or permit types she's was mentioning have actually been implemented for a couple of years. But based on the ability of switching to a new database and being able to better track, we've been able to sort of adjust those. And so the main one that would really be changing through this round, other than just increasing the overall amounts of all the permits, would be the major repair. So you can see there's actually 2 there. So looking at major repairs that are also undergoing like a community planning and permitting process, where they're typically a lot more back and forth, a lot more staff time for us to have. Well, could we do this? Could we do that? What about an ADU? Lots of conversation tends to take a lot more staff time and processes as they go through like architecture planning and construction. Often will push our inspection process out on the septic over years, often results in lots of renewals of the permits and things like that. So you can see that we broke those up because we also wanted to be cognizant that people's septic systems fail. And it can be, tens of thousands of dollars, like 20, 30, sometimes 40 or $50,000 to replace these. So we wanted to make sure that that the permit fee in itself wasn't really going to be prohibitive on top of an already expensive thing to do. So being able to keep those in a separate category is what you can see here. So this is the proposed permit fee and the overall revenue. Which gets us to about, you can see there's still a little bit of a gap there, but that's also because we do have renewal fees, we have additional inspections, additional design reviews. So it's usually just close to what that gap looks like actually between those 2 numbers. Are there any questions on the fees or this slide? I know I gave a lot of information for y'all to review before
I just want to get our order of operations right. Do we take public comment before the board discusses and asks questions, or we ask questions first?
You ask questions first.
Okay.
And then it'll be, before you make the vote, will be the public comment.
Okay.
Is interested about the sliding scale. Do you know like what percentage of people actually take advantage of that?
It is pretty small amount of people. I would say we maybe, like, this is not like, I did not look at that number, but maybe like 5 to 10 households a year.
Out of like
So we generally issue, you know, on average, like 270 to 300 permits annually. And that's like all of these. So, and then property transfers is a whole separate one. We issue about 400 to 500 of those annually.
Are there other board members that have questions online? I just want to make sure I get to you before I jump in with mine. Okay, so I have a couple questions. So just to clarify, if somebody has an existing property and they want to build an ADU on that property, does that fall under that new permit?
That would go, yes, because they would also have to apply for a building permit. And they also, so that's actually a really complicated example because if they have an existing system, it's potential that there's capacity there. So these are the sorts of things why we say if we adopt these new fees tonight, the team needs a little bit of time to think through how all these things come together, because as much as we want septic to be black and white and like all this regulatory stuff, it is just not. But theoretically, if they needed to put in a new system, that would be under that $3,000 permit.
Okay, so if they had capacity within the existing system, then
There's some other mechanisms we would
Okay.
look at. Gets a little more complicated.
I know this came up with some of the Marshall rebuilding stuff
Yes,
and. okay,
yes.
So, that was why I was interested in that. So I don't think we have anyone signed up. We might have a surprise comment, but part of what I'm curious about is between when we discussed this at the last meeting and when this came forward, how have we been outreaching to folks that might be interested
Sure.
in this, and what's been the response?
We did send out a survey to primarily our professional industry partners. And we asked them, you know, we didn't get into the very specifics. We talked a little bit more about like overall budget for the program and what we were being asked to kind of evaluate. And we actually got zero conversation, like never even had one of them pick up the phone. And these are people that we deal with every day and out in the field. We see them all the time and nobody really even brought it up. So I'm not sure if that was, we sent out a couple of reminders, so I'm not really clear if that was just an indicator of temperature or, but we have not really had the opportunity to do much with public because it's a little bit more complicated to get this information in front of them.
Correct me if I'm wrong, but my understanding is that typically counties don't do a general public.
Usually this is the when I've talked to colleagues, you're correct, Lexi, this is the forum.
Right, and I do recall the last time we increased the fees, we had one person, I think, show up to that meeting.
Yeah, and it was one of our professionals.
Okay, and,
Do you want to go to the next? Oh, you did. Never mind. Sorry, you're on it. Yeah, and this was just, I just also wanted to put out there that this will create about 75% of the cost because there was quite a few things that you can't, it has to be indirect and direct cost directly associated with that permit. So not everything can be recovered. And we do quite like enforcement, for example, and things like that.
Right. And now I'm recalling, Erin, that, so at the last time we discussed this at the meeting, it came up that I think we were already one of the highest
Correct.
counties for permitting. And this will put us, I think, probably much higher than.
Yeah. I think the other highest permit I've seen is like $2,000. So.
And the reason for that is that some other counties are subsidizing the cost of this.
In conversations that I have, and we meet quarterly with the other program managers like myself, and they all say that the county is definitely subsidizing a portion of the work. I think the other piece is that we have probably some of the most complicated soils in the state. A lot of other counties are really like, you know, they just have plains like Weld County or mountainous regions. We have everything and then anything in between. So we see more complicated designs here in Boulder County, I think, than even like Jefferson County.
So it takes more staff time.
Yeah.
Got it. Okay. That was it for my questions. Thank you. Okay, so, and I just want to point out what's on the slides and that if we approve these fees tonight, that staff will continue to monitor and may come forward with any adjustments based on what you're finding.
Yeah, since we don't currently track our data this way, we had to do a lot of sort of forecasting. So we want to keep a really close eye and make sure that we're not charging more than what permits should be.
Great.
But I will say we rounded down some of these numbers to be more conservative because we did not want to end up having to that
Great.
being overcharging situation. So
Yeah. And this was, I mean, in direct response to the commissioners requesting us to look for greater revenue,
That's correct.
Yeah. what we have control over in terms of fees.
Looks like we have no one signed up either online or in person for public comments for the OWTS fees.
Okay, so I think then the next step is that we need a motion to approve the new fee structure.
Yeah, this is Brooke. I move that we approve resolution 2023-02, which is the approval of the OWTS fees.
Okay, we have a motion and a second. All in favor? Aye.
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 Motion then passes unanimously. Thank you very much, Erin, for you and your team.
thank you.
Yeah, thank you to Erin and to Joe and to Celeste and to Catherine and so many people who worked on this project. Really appreciate being so diligent and really taking into account, like, how do we move forward in a way that's actually better than what we've been working with. So thank you for that.
Absolutely. Thank you.
Thank you very much. Item number 4 on the agenda this evening is the Marshall Fire litigation discussion. Vote for approval.
Thank you. So last week, we got a call from the county attorney's office letting us know that Boulder County was moving forward with a lawsuit against Excel in relation to the Marshall Fire and a query about whether we were interested in participating. After a few more questions and conversations, we realized we needed to bring it to the Board of Health. The reason that this is a little bit urgent is that we need to sign on before December 29th when the statute of limitations runs out. And Erica Rogers from the county attorney's office is going to give you a little bit more information. But I think what's really important to remember is that the vote tonight wouldn't commit us to anything. We could always pull out, but we can't join later.
Yeah, so I'm Erica Rogers from the County Attorney's Office. I sent out a memo on this and I don't know if you all had a chance to look at that, but just to sum it up, this is a lawsuit filed against Excel to seek recovery of costs and damages for responding to the fire. Boulder County Board of County Commissioners, as well as the town of Louisville and Superior are all named plaintiffs, and there may be more. At this point, I think there are at least 10 lawsuits and they're all being consolidated before a judge in Jefferson County. The law firm that is representing the county is a well-respected law firm that has been vetted by the county attorney's office. They would be outside counsel. They would be paid on a contingency, fee basis, which means no upfront costs. They would take 16% of any recovery. And let's see, and like Lexi said, the statute of limitations is coming up, so we need to file by the end of December. So that's why it's kind of a bit urgent. We just need direction from you as to whether you want to join as a plaintiff. And we do have the option of going into an executive session if you need legal advice, if you want more detailed questions that would go in that realm that we don't want to speak about publicly. So.
And what we would do if you voted to approve joining as a plaintiff is we would do a kind of a high level internal assessment of the likely damages that we would be able to include to make an assessment about whether it's worth it and come back to the Board of Health.
I see. So if we voted to join the lawsuit, then that would trigger staff assessing what the cost would be. And if we determine that it's not worth it, then we could pull out. Is that
That's correct. And just a reminder, these processes can take many months, if not years.
Hey, Lexi, this is Lindy.
Yeah.
I thought that this was contingency fee-based, meaning there were no upfront costs to the department.
I'm sorry if I didn't explain it well. What I was talking about is getting a sense of what the damages that we could claim actually are. So for instance, the amount of staff time that was dedicated to Marshall Fire Response, any operational expenses we expended. It could also include things like opportunity costs of grants that we usually get, but that staff didn't have time to apply for, possibilities like that. And that based on that, if it's not a lot of money and it would be a lot of work to document, then it may not be worth it for us to join. But if it is significant, then that would give us an opportunity. Did that clarify?
Okay, and it does. And are there costs associated with that analysis?
Staff time. Just
Staff time. So we would
Yeah.
not be getting external legal counsel to support us around what would be included in the suit?
get that. I'm sorry, I'm speaking for
That's
Erin.
okay.
Please,
That's
you-
okay, because you
be in your
do.
space.
They have experts who will look at all the damages, and they just need to know from us what we have done. But they can help us sort of figure out the different categories that are available, and we'll write that all up.
And I will tell you that the county is going through that process now, and I got a sneak peek. So I have a sense of the kinds of categories that they'll be looking for.
Okay, but just to clarify, because I'm not sure I got my answer, we are not paying fees to have that analysis conducted, correct?
And should there, I mean, I have to imagine that there's going to be a settlement with some parties of the plaintiff, but if there is not, I'm just wondering, I mean, what is the risk of PCPH in terms of expenses? Should there not be any, for instance, if we decide to join as plaintiffs and if we are not found to be entitled to any settlement dollars, do we then owe that legal firm for their time?
We do not, because they only will be paid out of any settlement or judgment by the court.
Okay.
And so when we said before, are they charging us for this damages assessment? Well, yes, in the sense that if we were to recover, they would be paid, but it's not an upfront cost.
Okay. So that's all included in the contingency. There's no upfront cost, just to confirm that one more time.
I guess I also want to just ensure if any board members have any need to go into executive session to ask for more specific legal advice, we can do that.
Know if any of the other plaintiffs have undergone.
Morgan, I'm so sorry. I don't feel like I have enough information to know what the liabilities are to the organization in entering into the suit. Can we get an executive session to understand more before we sign?
We can. So I
Well-
make a motion to adjourn into executive session, or I move to enter into executive session pursuant to Colorado Revised Statute 24-6-402-4B for the purpose of receiving legal advice for item number, back what the item number is. 4. Thank you. Item number 4 on our agenda.
4.
But I think we need a second to that motion. Okay, great. So and then we need to take a vote on the motion to move into executive session. All in favor?
Aye.
Aye.
To executive session now.
Since they're receiving legal advice, this will not be recorded. Staff, members of the public, we will need to move out into. I will stop.